A patient can prepare for their appointment with the reproductive endocrinologist. Before the appointment even gets started, they often will receive in the mail a questionnaire to fill out that runs through a detailed history regarding their medical history, menstrual history, pregnancy history. If they can come with that questionnaire filled out, and if they can be prepared to provide medical records from any physicians that they've seen in the past for any fertility testing or medical conditions that they've been treated for, because that first appointment is going to be very detailed, going over all of this information. They should be prepared for a vaginal ultrasound, which is also part of that first appointment, and the ultrasound is a great way of evaluating the uterus and the ovaries and how that will relate to future testing and treatment options. They should be prepared to ask questions regarding what their treatment options are going to be. You may want to ask the doctor about what prior treatments you've done and how treatments going forward may be different, and how you will know what's the best way to choose, what your next steps are, and what the next best treatment option is for you based on what you've done in the past and what you want to be doing going forward. A good hour is spent just discussing past history of this couple, what medical problems they have, what fertility testing they've already done, what gynecologic testing they've had, any prior surgeries, how many times they've been pregnant, what's happened with prior pregnancies, how long they've been trying to get pregnant. Many questions are asked about the menstrual history, as that is a big piece of the puzzle of trying to help a couple get pregnant. Usually the first appointment will also include a planning session, so that when a couple leaves after that first appointment, they know what the next steps are for what testing they need to do. When the testing is completed, it will be reviewed with the physician, and then that will often lead to what the next steps are going to be for treatment. They should also be prepared for the various treatment options to be outlined. We go through and say these are the options that you have available to you. We review what the pregnancy rates are associated with each of those treatment options, because that's a big piece of what helps a couple decide how they want to go forward. And then a financial counseling appointment is also at the end of that, where you get to sit down either in person or by phone with a financial counselor to find out what is going to be the cost of everything you've discussed. I think couples come to that first appointment with a lot of different experiences. Often patients have never met with an infertility doctor before and haven't done any treatment or any testing. So I think those patients are anxious about what they're going to find out, but a little bit less nervous about how quickly are they going to have answers. Oftentimes, though, we will see couples who've already been down this road. They've already met with other reproductive endocrinologists, or they have already tried other treatment options, and they can definitely want to know, well, what are you going to be able to do differently, or how do I know that the outcome is going to be different with you? So it does take patience, but I think that education is a huge part of it. I think that couples often come in and they're not sure that you're going to take the time to explain to them what testing you're going to do, why you're going to do it. And I think that if you take the time to teach your patients, then I think it puts them at ease, and they will often leave that appointment feeling like they've been heard and that they know what they're going to need to do going forward.